Pregnancy can be one of the most exciting times in a woman's life, but the back pain that can so frequently come along with it can put a bit of a damper on things. So we're going to go over 2 stretches that you can be doing if you're experiencing pregnancy-related back pain to help ease some of that discomfort and help you move a little bit better. So let's talk about why this pregnancy-related back pain is so common in the first place. One of the biggest reasons is because of the postural changes that happen during pregnancy. So let's take a look at the spine. Here's your spine right here. This is the back of your body. This is the front of your body. You have a natural curve in your lower back called a lordosis. As the belly starts to grow, the baby starts to grow, that lordosis becomes accentuated. And you can see then how we can put additional stress on those joints in the lower back, and then the muscles in the back will become tight as well. The abdominal muscles don't function like they once did because they're gradually getting stretched out, so they're not supporting the back like they once have in the past. So, as we go through stretches or exercises to relieve this type of back pain, we want to take the pressure off of these joints, work on elongating the muscles in the lower back, but make sure we do it in a gentle way so as to not throw anything off. We'll get to our stretches in just a minute, but one of the things that we do with our patients in the office who are pregnant is we do some manual therapy on their lower back and their hips. We loosen up the muscles and the joints in those areas. And we're lucky enough to have a table that allows pregnant ladies to lay on their stomach pretty much all the way up until the day that they're due. There's a portion that breaks away, that makes room for the baby. It's nice and comfortable, feels great after not having lied on your stomach for so long. And the lower portion of the table raises and lowers. It lets us work through the muscles in the lower back in a way that nothing else can. It feels awesome. We'll get the joints in those areas moving as well. And then we'll typically put some tape on the lower back. This tape is elastic. It lets you move, but it gives you some good support. It feels like you're taking some of the stress off of those muscles. So we'll go through that, and then we'll go through the stretches that I'm about to show you. As with anything, before attempting any of this, please speak with a medical professional. Don't go try and treat your own pain. This is just for educational purposes. So the first stretch that we typically take people through is what we call a band-resisted cat-cow. If you've done yoga in the past and you are familiar with the cat-cow movement, this one adds the assistance of a band. The band allows you to really focus on that rounding portion of the movement. That's the motion that is typically limited in this pregnant population. We talked about how the spine is so often in extension. If we can focus on that flexion, the rounding of the spine to take pressure off of the joints in the back and the muscles in the lower back, we can see a lot of improvement. So you want to put that band nice and tight around the lower back so you feel like you have something that you're pushing into, and then you're just going to let it fall into extension, into that rounding in the opposite direction, just to the point where you're comfortable, and you're going to repeat that motion 10 to 20 times. The next stretch that we're going to go through is the standing piriformis stretch. The piriformis is a muscle in the back of the hip that so often becomes tight in pregnancy. Taking it back to yoga, this is similar to the pigeon pose, but when you get real far along in your pregnancy, pigeon pose might be a little uncomfortable depending on who you are. So we take it into a standing position. You're gonna find a surface that's a little higher, maybe around the height of your bed, and you're gonna cross your leg up onto that surface in a figure 4 position. You can place a pillow under your knee if you need a little bit more support. Then you're gonna keep a nice upright torso and lean your body forward until you feel a nice gentle stretch through the back of your hip. Again, we don't want any pain with this, just a nice gentle stretch. Then you're gonna move back and forth into this position about 10 times. I hope you found this information helpful. If you are experiencing pain, please speak with a medical professional. Don't go trying to treat pain yourself, especially during a delicate time like pregnancy. If you do have back pain and you're pregnant, come on in and see us. We would be happy to walk you through this process and take you through an individualized approach that fits your needs best. Feel free to visit us at TruMotionTherapy.com to learn more.